Welcome to Extra Mile Medics, where we seek to make your journey in school easy and enjoyable. In today's video, we are going to be looking at one of the structures of the urinary system. The ureter. A pair of narrow, thick-walled muscular tubes, which transport urine through peristaltic movements from the renal pelvis to the urinary bladder. Each ureter is approximately 25 centimeters long with 3 millimeters diameter, about the size of the small grain of rice. Location-wise, ureters are retroperitoneal structures, which begin at uteropelvic junction in front of tip of transverse process of lumbar 2 vertebra. They terminate in the pelvic cavity where they empty into the bladder, and they lie right in front of the psoas major muscle. The ureter is divided into 3 parts according to its location. Abdominal part, which is from renal pelvis to the pelvic brim. Pelvic part, which is from pelvic brim to the bladder. Intramural part, within the bladder wall. There are 3 anatomical constrictions of the ureter. Junction of the renal pelvis and ureter pelviureteric junction. Area where ureter crosses pelvic brim. At site of entrance to bladder ureterovesical junction. There are 2 other sites of constrictions described by surgeons. At juxtaposition of the vas deferens or broad ligament. At the ureteric orifice. The arterial blood supply is as follows. Upper end is supplied by the renal artery. Middle portion by the testicular or ovarian artery and common iliac arteries. And the pelvic portion by superior vesical artery. For the venous drainage. Blood drains into renal and gonadal veins. Now on to the innervation. Sympathetic nerve supply of the ureter is derived from T10 to lumbar 1 spinal ligaments, which reaches ureter via renal and superior hypogastric plexus. And parasympathetic nerve supply of ureter is derived from S2 to S4 spinal segments via pelvic splanchnic nerves. Last but not least, let us take a look at the lymphatic drainage. The drainage follows a pattern similar to blood supply. Upper end drains into lumbar nodes. Middle part drains into nodes associated with common iliac vessels. And the inferior part drains into nodes associated with external and internal iliac nodes. Thank you for watching the video. Hope you learned something. Don't forget to subscribe and press the like button. See you next time.